This new system will be a tremendous step forward in our vaccination work. We've been getting around 130 doses, first doses per week from the federal government. That's an increase from the early weeks when we were receiving about 105,000 doses per week. But it's obviously not enough to meet the demand. I know that President Biden's administration announced yesterday that they are increasing allocations to the states, and that is wonderful news. We'll take every dose that we can get. We are in regular contact with our federal partners, both in the Biden administration and in our congressional delegation. I promise you we are not shy in asking for what we need, and later this evening I'll be in communication again with our congressional delegation. And we have had a very good working relationship, and they have been very helpful, especially with COVID relief. Just last week, I joined Maryland Governor Hogan and D.C. Mayor Bowser in writing a letter asking that the federal government help us vaccinate federal employees, as well as contractors, which includes thousands of employees in Virginia. I spoke about vaccine supply limitations. An additional and separate pot of vaccine is going directly to our pharmacies through their partnership with the federal government. Right now in Virginia, that's just one pharmacy chain, but our health department is working with the Centers for Disease Control to put a greater emphasis on community pharmacies. We also want to ensure that pharmacies can work with our pre-registration system. I know that a lot of our small pharmacies are willing and eager to vaccinate their patients. Many of those pharmacies haven't gotten any doses yet because the supply is so limited. But we know that small, independent pharmacies are an important partner in this effort, and we're working to include them.